Hi there, my name's Anthony Hurley, and I'm going to be showing how to perform trach care and trach suction. And so what I'm going to be doing is I'm going to be talking through and demonstrating some of the steps. Obviously, the procedure I'm going to be doing is better demonstrated in a lab or hospital setting, so not everything is going to be perfect, but I'm going to be vocalizing how it should be. This is a sterile procedure, so in the real performance of this, I would not be dropping my hands below my waist. Obviously, I can't raise my desk up to demonstrate this, but I'm just saying in the real procedure, no below the waist, no crossing over stuff. So you get the point. I'm gonna get into it. So what I would do is I would knock on the door, come in, wash my hands, acknowledge Heinz. So my patient, hi Heinz, my name's Anthony. I'm gonna be your nurse today, and today I'm gonna be performing trach suctioning and trach care. But first, can you verify? So Heinz can't communicate with me right now. So what I'm going to be doing is establishing a form of communication with him. So I'll be saying, Heinz, does thumbs up sound good for yes and thumbs down sound good for no? And he gives me thumbs up for yes and it sounds good. So now I'm going to verify his name by checking his armband. So is your name Heinz Ward and your birthday March 8th, 1976? And he gives me thumbs up. And do you have any allergies? Thumbs down, no, and okay. And so I've washed my hands and I did that, and now I'm going to be explaining the procedure to him. So what I'm going to be doing, Heinz, is I'm going to be taking a suction tube and sticking it down your trach and suctioning up some of the secretions so that you'll be able to breathe easier. And also I'll be cleaning around your trach site and just getting it all fresh and clean. Should take 15 to 20 minutes, okay? And I pull the privacy curtain, I wash my hands, and now we are going to begin. So I will start by hyperoxygenating Heinz. So I turn the oxygen up to 100%, and he's got a kind of a mask over his trach that's giving him oxygen at a prescribed rate. I'm turning that up, so he's being hyperoxygenated right now. And I already told him the whole procedure. All I need to do is told him the time it was going to take. Okay, so now we're going into it. So, wash hands. Yeah, I've got my supplies that I gathered before I came in the room. So I'm going to start by pulling this sterile drape. Okay. Okay, so now I've got this drape here like this, and what I would do is I would place it right here on Heinz. And this is a waterproof, sterile pad drape on him. So it'd be right here underneath his trach so that any secretions and all that would not get on him. So that's what I'm going to be demonstrating now. Okay, so now that's on him. Discard of this, and my hands are washed. And now I'm going to be opening this kit and removing the sterile gloves. And I would be performing this procedure, all these procedures on a side table near the head of the bed. And so it would be the head of the bed, and that's where it would be, but for now it's here because Heinz is, I can't do it with a second table. There's no second table. So if I hadn't said that already, I would get Heinz to a comfortable working height, and I'd raise the head of his bed so that I could easily work at his trach. Okay, so if I hadn't done that, now I have washed my hands, and now I've got these gloves out, and I would not turn my back to the sterile field. Okay, open up my gloves, grab on the lip, okay, reach for the stars, got it, good. Normally it's not this reverse, but the gloves are in backwards, so reach for the stars, I grabbed on the lip, hold it up, now my hands are sterile. He's sitting upright, got him there. Now I've got this sterile kit right here. And I would, before I put these gloves on, I would have turned the suction to anywhere between 80 and 120, and I would have put the tubing out over Heinz's waist. And now I'm removing this top here and pulling the lid off. And now I'm grabbing this here And I'm being careful to hold the tip and this so no sterility gets broken. So I'm grabbing the tip and I'm wrapping it up around my hand. And now what I'm going to be doing is grabbing the tubing or wherever I have it placed, and I'm going to be attaching it here. So the suction tubing is attached to here. This hand's now broke sterility. Now I'm going to do a practice suctioning right here. So I'm going to go. So I lubricated and flushed this tubing. So every time I push down, this suctions. So now I'm coming over to Heinz, who's sitting upright and he's got the oxygen full up. So now Heinz, I'm going to remove your oxygen here and go whoop. It's removed. Now I'm going to be inserting this in through the top of his trach, 5 inches or until he coughs. So it's going down his throat. And then if I meet resistance, I pull back a little bit. Or if he coughed, I'd pull back a little bit and I'd start. So I'm going to be suctioning intermittently and twisting in motion on the way out. So this is what it would look like. It would go. Okay, and then I would have the tip, and then I would put the oxygen back on Heinz, and I would note the amount of secretions I got, and if he was still congested. So clear the catheter. If he was still congested, I would suction again in a minute, but he is not congested still. So now I'm going to move on to my next step, which is cleaning this up and then moving into trach care. So I'd wrap this up in my glove, pull my glove, discard it, and then he's got his oxygen back on, but he's got a sterile gauze pad around his trach site, and I'm going to remove that and see. I'm going to be observing it using Taco, so type, amount, color, odor. Okay, and so I did that, and that's in this glove, and he's oxygenating right now, and got that, and this would be going in the garbage here. So I'll just pretend it's in the garbage right now. Wash my hands again. So while he's getting that there, I'm going to be setting up my kit. So this would be sterile water and it would have a lid on it. So what I'm going to be doing now is my hands are washed. I'm going to be removing the top lid here. I'm going to be grabbing my sterile drape here. I gotta find it here. Always says plastic. Okay, this side here is plastic on the bottom. So I'm going to be laying this out here. So that's where it goes. I'm on the bedside table, remember? Okay, and then I'm going to be grabbing my gloves, my sterile gloves, and they would be over here on the bedside table. So before I grab that, then I would grab this here, and I would dump it onto my sterile pad here. And I left this dressing on Heinz's chest still because it can stay there the entire procedure because it's still sterile and it's still keeping him protected from secretion. So now what I'm going to be doing is setting up my kit and then I'm going to be pouring the water first. So I'd remove the lid and I'd pour some out over the lip into the trash. So that's what I just did. Now I would keep sterile field by doing it, bringing it around, pouring in. Okay, garbage. Put the lid back on, set down. Now I'll be putting on my sterile gloves. So I'm still facing the sterile field. I'm gonna move this over a little bit just for sake of room on the table. Okay, pull. Okay. Gonna have to twist this around just because the gloves were put in backwards. And now grab. Reach for the stars. Grab the lip, the under, and reach for the stars. Good. Now I'm going to be setting up this kit, so I don't need the collar. I've got the new sterile pre-cut pad for the trach. I have 2 what I need to be wet pads, 2 dry pads for cleaning up. I've got the pipe cleaner, so what I'm gonna do is I've got these 2 dry pads, and I'm making sure none of it's sticking out over the kit. 2 wet pads, I'm gonna wet them down, and rag them out, wet them down, rag them out. Okay, so that's how we'll clean it. Got my pipe cleaner, put that in here. I've got these 2, I forget what these are called, but they'll get wet, and then I'll set them in here, and that'll be for cleaning. And then I've got these 3 pipe cleaners, and I'd fold them over and twist them, and this is gonna be for drying the trach once it is removed, once it's washed. So with that said, this would be over here on the side table where I set it up. So now I'm gonna move this over to there because that's where it would have been, and just for the sake of this demonstration, it'll be easier to demonstrate if I come over here and just pretend that this is where I was the whole time. So I'm coming over here, this is where it was. And now this is gonna be the trach collar right here. So, got the kit here. Heinz is still oxygenated. So I'm going to remove his oxygen source now. And I'm going to, with my non-dominant hand, remove his trach inner tubing. So it like untwists and pull it out. And I'm holding only from this part, this top part here. I'll never touch anywhere else. I don't touch the inside, don't touch the bottom. So what I'm gonna do is I'm gonna wash. So from the top in only, down. So wash, wash, wash. If this could go in, I would do it. So wash, wash, wash. And then, this can just be discarded, I guess. So then, in, rinse, rinse, rinse is what I just did. Now tap, tap, tap. And now I've got these pipe cleaners. So from the top, dry, dry, dry. And then the other side, dry, 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 without touching anything with this hand. And now I'm gonna stick this back into Heinz's trach piece, and it's gonna snap back in. So in, and then twist, and it snaps back into place. Good. And so now I'm gonna go and grab this here, and I'm gonna clean the top part first. So this is Heinz's neck. Clean up on the top part above the collar, underneath it. Okay. Now I'm gonna clean the bottom part underneath it. Okay. Discard. Now I've got the wet gauze, or whatever this is called, above it. Drop. Below it. On top, cleaning it. I mean, not on top, but like on top of the trach piece, not the hole, but like the place that holds it, the piece that holds it in place. Drop. Then I've got 2 dry ones. So top, dry, underneath too. Bottom, dry, underneath. Drop. And now I've got the new sterile came pre-cut like this pad that I can put up underneath the trach, and it will just be up under here, and it's fresh and clean, and it will catch any drainage. And I want to make sure that it's not wrinkled and that it's not causing any sort of unnecessary rubbing. So now that that's in place on Heinz, then I can put his oxygen back on his trach. He's still sitting upright and all that. And I'm gonna clean up now, and I'll leave him fully on oxygen right now until I'm done cleaning up. So pretend I'm cleaning up, putting all this in the garbage, packing it all up. I can remove this sterile drape now. Okay. Pretend this is all in the garbage. It's all in the garbage. Remove my gloves. Okay, wash my hands, come back to Heinz. Now I'm gonna get his oxygen set down back to his prescribed rate. Oxygen back to the prescribed rate. Now I'm gonna make sure the bed is low, locked, side rails up ×2, call light within reach, bed alarm on if indicated. Is there anything else I can do for you, Heinz? He says, no, nothing else I can do. All my pre-checks, or all my safety checks are done. Remove the privacy curtain, wash my hands, and I would document. Thank you.